special webinar brought to you jointly by Physicians for Social Responsibility and the Sunrise Project, creators of the Insure Our Future campaign. Today, our organizations released a new white paper called Running Out of Time, as well as a letter signed by hundreds of health professionals calling on the health and life industries to divest their holdings in oil and in gas companies. Why are we calling for divestment? We live in dangerous times. Now, to be sure, all times are dangerous and precarious for some people. What's different now is that we're facing multiple major threats to the health and well-being and potentially the lives of virtually everyone on the planet. These major threats include COVID-19 and climate change. Now, when we face threats to health and life, the health and life insurance industries are supposed to mitigate those risks by providing access to health care in the first case and financial support to our survivors in the second. So why would those companies invest in fossil fuels, which undermine health, increase susceptibility to COVID-19, and contribute to climate change? And yet they do. America's 19 largest health and life insurance companies, according to the most recent available figures, have collectively invested over $183 billion, that's billion with a B, of their customers' premiums, the money you give them if you're insured, in fossil fuels. Most of that money, $178 billion, was invested by life insurance companies. Now, those investments undermine your health, make you more susceptible to COVID-19, and contribute to climate change. They also increase racial justice in the United States. I'd like to take a moment to reflect on that. First, let's think about the air pollutants that are generated by our reliance on oil and gas. The prevalence of air pollution disproportionately affects Black people, Native Americans, and people of color. This is very clear in the case of asthma. The burden of asthma in the U.S. falls disproportionately on Black, Hispanic, and American Indian and Alaska Native peoples, who have the highest asthma rate, highest levels of deaths, and of hospitalizations. One important factor that contributes to this disparity is discriminatory housing patterns. Poor people and minorities are more likely to live in heavily polluted communities, near fossil fuel burning factories and power plants, and or near highways, shipping lanes, and airports where vehicles, of course, are burning these oil-derived fuels. Abundant research shows that people who live near these sources of air pollution experience greater health effects associated with pollution. And we're now learning that these same populations that are so vulnerable to air pollutants are also experiencing higher numbers of COVID-19 infections, clinical complications, and deaths, multiplying the environmental justice burden of industrial and fossil fuel pollution on these very communities. A similar pattern exists in regard to climate change. As fossil fuels increase climate change, higher temperatures are increasing diseases and premature deaths. At the same time, climate-driven floods, storms, and wildfires are increasing in frequency, duration, and intensity. They also cause more deaths and injuries. And consistently, these harmful impacts disproportionately affect low-income communities and communities of color. That's only likely to increase in the future if we don't stop climate change. Climate-related impacts like heat stress, food insecurity, asthma, other respiratory diseases, and mosquito-borne diseases will continue to increase. And, guess what? You already knew. They will affect people who are already harmed by pollution, by poverty, by lack of access to health care, and by the emotional stress that's associated with these problems and with racism. These facts should concern all of us, and we should bear them in mind as we think about the actions of the health and life insurance industries. So could we have the next slide, please? And I'll introduce our speakers. I actually forgot to introduce myself. Excuse me, I'm terribly sorry. I'm Barbara Gottlieb. I'm the Director for Environment and Health at Physicians for Social Responsibility in their national office. You'll next hear from our first speaker, Dr. Michael Donnenberg, about the health effects associated with fossil fuels. Fossil fuels actually pose a double threat. They're a major cause for climate change, which of itself increases risks to life and limb, and they also spew toxic chemicals into the air and the water, onto the land, that eventually end up in our bodies. Dr. Donnenberg will also touch on solutions in the form of a transition to a clean energy future based on safe, healthy, renewable energy sources. This is a transition that's already underway, but it's hampered both by the COVID-19 pandemic and by ongoing investments in fossil fuels. Dr. Donnenberg is a professor of internal medicine and of microbiology and immunology at Virginia Commonwealth University and Senior Associate Dean for Research and Research Training. He came to VCU in 2016 after 27 years at the University of Maryland, Baltimore. He received his MD from the Columbia University College of Physicians and Surgeons and trained in internal medicine and infectious diseases at Johns Hopkins Bayview and Tufts New England Medical Center. You'll hear from our second speaker, Mary Sweeters of the Sunrise Project, about the role of the life and health insurance industries, their investments in fossil fuels, where they invest and how much, why these investments are bad, both for us and for the industry, and just as importantly, what actions we can take to pressure the industry to divest its holdings in oil and gas operations. Mary Sweeters is the senior campaigner with the Insure Our Future campaign, a project of the Sunrise Project. Let me note that the Sunrise Project is an Australian organization. It's not the U.S. youth-led Sunrise movement. Mary brings over 13 years of organizing, activist training, and campaigning experience to her work, including previous work at Greenpeace US, where she was a campaigner on some of the iconic oil fights, including fighting Arctic drilling and pressuring banks to stop lending money to the Dakota Access Pipeline. Mary now works with insurance professionals, NGO partners, and public sector leaders on the divestment campaign you'll hear about today. You'll hear about that in just a moment. Before we begin, a few really quick housekeeping items. You should be on mute. If you aren't on mute, please mute yourselves, and you should stay on mute during the presentations. After the presentations finish, we'll have Q&A. Because we're a large group, rather than doing the Q&A verbally, we'll ask you to put your questions into the chat boxes, and I'll read them out from the chat box. Finally, this webinar is being recorded, and a link to the recording will be sent to you in the near future by the Sunrise Project. So with all of that, it's my pleasure now to turn the microphone over to Dr. Donnenberg. Dr. Donnenberg?
Hello, everybody. Thanks for that introduction, Barb. You know, the facts have been laid out, and they're pretty incontrovertible. Global temperature has been rising ever since the beginning of the Industrial Revolution. That rise in global temperature is associated with increased concentrations of greenhouse gases in the atmosphere. And the principal source of those greenhouse gases is the fossil fuels that we burn to provide electricity, to warm our buildings, and to provide fuel for transportation. Now, these same fossil fuels have direct adverse effects on our health. The mere burning of them produces particulate pollution, which harms our bodies in many ways. The increased levels of nitrogen dioxide can react with heat and organic material to increase the production of ground level ozone. And even in just extracting these fossil fuels from the earth, there are hazards in the form of toxins and chemicals that are released that do direct damage to our bodies. And of course, the ensuing increase in temperature also creates adverse health effects. And those include just direct heat-related illness, as well as the illnesses that arise out of the extreme weather events that are occurring with increased frequency. So let's look a little bit more closely at the causes of these adverse health effects. So as particulate matter rises, so do illnesses. And whenever we burn fossil fuels, we don't just produce beautiful carbon dioxide, which is raising the temperatures in the form of its greenhouse gas and water. We also have the waste side effects of burning these materials. And one of those side effects is particulate matter. These are microscopic particles that we breathe, and they damage the lungs. They cross into our blood vessels, and they cause inflammation in the lungs and end organs. And the particulate matter is associated with increased risks of heart attacks and strokes, of lung disease exacerbations like asthma and chronic obstructive pulmonary disease attacks. And there are also higher levels are associated with greater risk of low birth weight and prematurity. And the ozone I mentioned before that's produced as a byproduct of combustion of fossil fuels, that ozone is a highly reactive oxygen species that causes a lot of inflammation in the lungs and is one of the contributing factors to asthma. All of these effects are worse in communities that are located more in proximity to places where fossil fuels are burned. And so there are vulnerable populations at increased risk, and those same vulnerable populations are those that have been affected in the United States by redlining, by the inability to own property, and by poverty. The principal causes, coal, petroleum, and natural gas, contribute in different proportions to these effects, with coal being by far the dirtiest fuel, but natural gas, promoted often as being clean, causes all of these same problems as do petroleum and coal. So when you burn coal, you not only get carbon dioxide and water, you get coal ash. And you get coal ash in enormous quantities. And something has to be done with that coal ash. And so it's put into large coal ash ponds. And the coal ash contains a litany of very scary toxic metals, some of which are listed here. They include arsenic, lead, mercury, cadmium. These toxins are associated with a huge array of adverse health effects, the scariest and worst types like cancer and heart disease, neurological problems, cognitive defects, developmental delay, bone problems, and birth defects. They're truly dangerous toxins. And these ponds, these huge ash ponds, are not fully contained, and the toxins can leak into the groundwater and get into surrounding communities. They can and do, because the U.S. Environmental Protection Agency has reported that living near a coal ash disposal site can increase the risk of cancer and other diseases. And furthermore, these ponds can rupture, as shown here in an example from Tennessee, where a huge pond ruptured into a river after flooding and caused tremendous environmental damage for miles and miles downstream, resulting in a EPA Superfund cleanup site. So we hear a lot about fracking or hydraulic fracturing, and this procedure has really increased the production of natural gas in the United States and lowered prices of natural gas. What is fracking exactly? So in fracking, huge quantities of water are delivered deep underground under extremely high pressure so that the shale ruptures. And when the shale ruptures, the methane underneath is released and can be collected. Now, that water isn't pure water. They add numerous compounds to make it more efficient, and those compounds include dangerous carcinogens and neurotoxins, including benzene, toluene, and formaldehyde. They attempt to collect that water, but it's very difficult to detoxify the huge quantities, and they don't collect all of it, so some of it can leak into the water table. Furthermore, not all the methane is collected when they do this, so there's a lot of methane that escapes into the atmosphere, and methane is a very powerful greenhouse gas, estimated about 30 times more powerful than carbon dioxide. And also particulate matter is released directly into the atmosphere from fracking. And so these wells, which tend to be in rural communities that are used to some of the cleanest air in the country, actually have been, contaminated with this harmful particulate matter. So just the burning of fossil fuels itself by raising temperatures has other indirect health consequences, and direct heat-related illness associated with rising temperatures is one of those consequences. So what I'm talking about here is either heat exhaustion or heat stroke, the latter a very serious illness characterized by very high temperatures and in the person, and end organ damage. And heat-related illness kills more than 600 people per year in the United States on average years, but during heat waves, they can kill far more. Just in 1 week in Chicago, a few years ago, more than 800 people died. And in Paris in 2019, when they reached a record temperature of 108 degrees, well, over all of France, 1,800 people died of direct heat-related illness. Again, vulnerable populations exist that are at much higher risk, and those include the elderly. Women who are pregnant can go into premature labor. People who work outdoors are at much higher risk. And again, those same people who are impoverished or who are isolated are higher risk. Urban areas that had been redlined in the past and home ownership was impossible are those same areas have very few trees, and the temperatures in those areas can be 2 or 3 degrees higher than in surrounding communities. So the people there suffer from higher temperature. At the same time, they may have trouble affording the electricity required for air conditioning and be unable to pay those bills. People with chronic diseases like being overweight, heart disease, diabetes, and people with mental illness are also at higher risk of heat-related illness and death. And of course, these rising temperatures are leading to extreme weather events. And when we're having extra moisture in some parts of the world, we're also having drought in other parts of the world. Africa has been experiencing, huge areas in Africa have been experiencing extreme drought for almost a decade now, and that's led to extreme malnutrition. And that and rising sea levels have led to mass migration, and refugee camps are notorious breeding grounds for a variety of illnesses and poor healthcare. The wildfires we've experienced lately have been unprecedented. They're far more frequent than ever in history. They're far more devastating in terms of property damage and loss of life. Just this year and late last year, from December into January, 20 million acres burned in Australia. And then much more recently, more than 5 million acres in California, Oregon, and Washington have burned. And more people are dying in those fires, but the effects are far more widespread than the fires themselves. As shown in this kind of iconic photograph from just a few weeks ago, the particulate matter that comes from wildfires is equally dangerous and leads to increased rates of asthma, emergency visits for heart attacks, and other acute illnesses that are hundreds of miles removed from where the fires are burning. And a lot of the same can be said for tropical cyclones. Last week, just a few days ago, Hurricane Delta hit Louisiana. This is only the second year in history where they've run out of names from the alphabet due to increased numbers of tropical cyclones. And the devastation has been, in terms of property damage, has been far greater than ever in history. But again, when these events happen, we get many people who have to shelter. And sheltering during the COVID-19 pandemic is particularly dangerous. could lead to further spread of the virus. And once again, echoing what Barbara said, people who are impoverished or are disadvantaged have higher rates of COVID-19 infection. They have higher rates of underlying diseases that predispose them to COVID-19, and the same particulate matter, burning particulate matter with disproportionately affects them, also increases their risk of COVID-19 illness. So we have sort of these three things coming together at the same time to threaten human health. And we mustn't forget the effects of climate damage and burning fossil fuels on mental health as well. All of these physical injuries have mental health consequences. So going through any of these chronic or acute diseases can affect people's mental state. Violent behavior, suicides, and homicides all increase during heat waves. And these catastrophic events like hurricanes and wildfires can lead to increased depression and anxiety, loss of property, and long-term post-traumatic stress disorder. So that's the bad news, but you know, the good news is that solutions are right here at hand. We know we can make a transition to away from fossil fuels and to clean energy sources, whether they're hydroelectric or geothermal, or with plummeting prices, wind and especially solar are becoming highly attractive alternatives to burning fossil fuels. And the cheapest, quickest solutions are more energy efficient buildings and more energy efficient appliances, and transitioning away from internal combustion engines to electric vehicles. All of these things can be accelerated and put into place. So as a physician, you know, I have come to ask myself, am I doing the best for my patients if I'm only caring for them one at a time for their diseases, when the planet is getting damaged and the health effects of that damage are going to overwhelm the health effects of individual people? And I know the answer to that, and that's why I'm here today. But insurance organizations that are dedicated to protecting our health, to keeping premiums low for their members, they have to ask themselves the same question: how can they be investing in the very industries that are damaging the health of their clients while they're trying to protect their clients? So for more on that, I'd like to turn things over to Mary Sweeters.
Thank you. Thanks, Michael. And thanks to everyone for joining today. I'm just going to take a minute here to share my screen. Make sure that you all can, excuse me, see that. Great. And now I will, oops. Excuse me, just for 1 second, I will get into presentation mode. Takes a minute. Before I start, I do want to say thanks very much to folks for joining. I know we have a mixed set of folks in the audience today. We have health professionals, health advocates, folks who are more oriented to the climate movement and climate advocacy. So I know some of this material may be familiar to some and some of it is new to others. So really excited to have everyone joining today. And I would like to just take a moment too to feel free to share articles or other supporting material in the chat for other folks to read after this webinar. So yeah, I'm going to talk a little bit more about the campaign to get the insurance industry to stop supporting the fossil fuel industry. as a critical piece of how we're going to transition capital out of the fossil fuel economy and into clean energy future, and to solutions to climate change, and how the health insurance industry in particular is so key to that. So let's see here. Go to next slide. So I'm going to talk a little bit about kind of the entire insurance industry at large, and then we'll focus in on health insurers, since that's of course the topic for today. But for folks who aren't as familiar with how the insurance industry might be connected to fossil fuels and how it enables fossil fuel expansion, there's sort of two key ways. One is through underwriting, so actually providing insurance policies to help build fossil fuel infrastructure, whether it's a coal plant or a pipeline. As we see here, fossil fuel infrastructure projects need essentially three things: permits, money, and insurance. This doesn't, of course, apply to health and life insurers. Their role is on the investment side, which I'll get to in a minute. But I did want to just kind of give this bigger picture context for how the insurance industry is connected to that. So an example of this is the Trans Mountain Pipeline, which some folks may be familiar with. This is a tar sands pipeline expansion project in Alberta, Canada, which has been very controversial, is largely opposed by First Nations communities there, because they will be affected directly from oil spills and other exposure to the project. And this document here down below is actually a copy of the documentation of who is providing the insurance coverage to build this pipeline expansion. So this is one way that insurers are connected to the fossil fuel economy. And then the other way is through investments. And that's really the focus for today, is that this figure here, $24 billion, this is just the investments in fossil fuels held by the top 10 US health insurers for whom there's publicly disclosed investment data. So this is not even the entire US health insurance industry or health and life. As Barb said earlier, the figure for the top 19 US health and life insurance industry is $183 billion that they held in assets in coal, oil, gas, and utilities. So this figure here, 24 billion, you can see is just sort of the tip of the iceberg for how the health insurance industry is supporting fossil fuel companies. And some folks have asked, well, how do we get this information? So the California Department of Insurance and the National Association of Insurance Commissioners, we cross-referenced information that both of them provided to get these figures. And we're hoping that even more updated data will come out either at the end of this year or early next year, when the Department of Insurance in California gets an updated set of figures from the companies themselves. And as Barb mentioned earlier on, I just want to really highlight that this is an environmental injustice, that environmental inequity is at the core of these issues. We just heard from Michael, all of the different health impacts that both fossil fuel exposure and climate change have. And we know, this has been well documented, and we know from hearing from communities that this disproportionately affects communities of color across North America, whether it's First Nations communities, as I mentioned, next to proposed pipelines like Trans Mountain, or communities sited next to refineries and coal plants and other kinds of infrastructure. So I just want to underscore that this is a core piece of this issue, and that going forward, I think we're really looking to continue to highlight this issue as part of this campaign. And I'll introduce here the Insurer Future campaign for those who are not familiar with it. So the Insurer Future Network is a global network of NGOs who have been working for the last few years to get the insurance industry to stop underwriting and investing in fossil fuels. The Insurer Future US branch of that has been really focused on a few different companies in the last year or so. I think we have maybe some of our partners in Connecticut who are joining the webinar today. They have been doing some great work to put pressure on a number of insurance companies, actually including Cigna earlier this year as one of the health insurers. But here you see some imagery from some of the work that's been done to highlight Liberty Mutual, which is both providing insurance coverage for pipelines and coal plants and other fossil fuel infrastructure, as well as also investing heavily into these industries. So this work, involves all sorts of different groups, indigenous-led organizations, climate advocacy groups, other public interest organizations who are all coming together to see if we can put a lot of pressure on the insurance industry. So we're really excited to sort of open up this new area that's really singling out the health insurance industry because it is such an egregious hypocrisy for what they're doing. I also just wanted to provide a little bit of context for the demands we're placing on the insurance industry to divest from fossil fuels. The context is that financial institutions, including the insurance industry, are leaving the fossil fuel sector, largely starting with thermal coal. And now increasingly we see that in oil and gas, whether it's banks or insurers, asset managers, or other financial institutions. So this is not some wild and crazy ask. This is actually part of a growing trend of financial institutions who are exiting the fossil fuel sector. It's not happening fast enough based on the climate science, but it is certainly a trend that is picking up steam, and it is pretty outlandish that the health insurance industry in particular is lagging so far behind. And I just wanted to note for folks, there's a lot of great information here from the Institute for Energy Economics and Financial Analysis, commonly known as IEFA. They have a lot of great data and put out a lot of really useful reports. So for folks who are maybe less familiar with the climate finance side, this is a great resource. But just to kind of really highlight here why health insurers should divest from fossil fuels, in addition to what we heard earlier from Barb and from Michael, in terms of this is completely contradicting their mission to provide support for promotion of human health. There are other aspects to this. One is the financial risk that investing heavily into fossil fuels presents. We have seen the value of fossil fuel stocks continually decline over several years, and then even more so this year because of the pandemic. But this was a trend that has been long established. In fact, I believe it's for the last 2 or 3 years that the energy sector has performed the poorest within the S&P 500. And we know that what's called transition risk, where policies that may be implemented from legislators may be posing additional financial risk that these companies will have to answer to as we are kind of recognizing the risk from climate change and trying to adopt policies to do that. So investing in these companies right now is also its own financial risk. And in fact, entities like Moody's, which provides financial service, advising services and ratings for credit agencies, has said that it's favorable for companies who are leaving coal, particularly right now, for their own kind of financial health. So that's another reason that health insurers should be just kind of leaving the fossil fuel sector altogether. And then finally, what we've started to see is that this poses reputational risk if companies that are supposed to be promoting human health are seen as directly supporting the fossil fuel industry, which people are increasingly aware of, the health harms that it's causing. This is something that could potentially affect policyholders, but especially for health insurers, I think employees and potential employees. We know the insurance industry broadly has a lot of positions that they fill as their largely baby boomer workforce is retiring. And so they need to be seen as, kind of answering to a lot of these issues that the incoming workforce cares about. And we know that the younger generation, the incoming workforce, cares a lot about climate change and about social responsibility. So increasingly, we're going to see this kind of reputational risk on health insurers. So as I mentioned, we're really excited about the launch of this effort to focus in on health insurers because there is such a kind of a clear case to be made for why they should be divesting from fossil fuels. Today, we released a letter signed by over 60 organizations, probably including many of the ones that you all here today are involved with, that we'll be sending to the top 10 US health insurance companies that we have investment data for, calling on them to divest. We'll see what kind of response we get in the next coming weeks here from those companies, but it'll be an initial start to engage with them. We've also released this briefing paper. This is an image of the cover of it. Many thanks to Barb and to PSR, co-authored this briefing paper, which helps to kind of lay out make the case for what are the harms to human health from climate change and from fossil fuel exposure, and why health and life insurance companies should be divesting from them. But as noted here, this is just the start. We'll be doing a lot more work together. And I do want to just take a moment to thank PSR, Healthcare Without Harm, the Climate Health Network, Medical Students for Sustainability, who were all instrumental in putting a lot of pieces together to kind of bring this to fruition today. So thanks again to all of you. And I guess I'll pause there. I think with that, I think we'll be opening up to questions. And so Barb, I'll turn it back to you and I'll stop sharing my screen.
Okay, Mary, I'm glad to rejoin you guys. We have a few questions posted on the chat. Let me first urge all of you who have questions to write them up right now. Of course, you'll be able to see one another's questions on the chat, but I'll be sharing them so that our presenters can respond. And let me start with a question of my own. A lot of our audience today is made up of health professionals, medical professionals, or people in the health fields. Could you talk a little bit more, Mary, about the role that we can play? Certainly this letter that you were just referring to has gone out today, but what are some steps that we as health professionals will be able to take to help fight against divestment in the coming weeks and months?
Thank you. Yes, I'm glad you mentioned that. So I can't really, I think, emphasize enough the importance and the value of the voices of health professionals in this particular fight. I think it's not been as prevalent in this campaign, and is something that is so valuable to bring that expertise to this conversation. So I think there are going to be a lot of different ways for health professionals to be involved. We'll be interested in working with folks who are available to work with us to write opinion pieces to be placed in various journals or press outlets, engaging, maybe sitting down with some of these companies and actually talking with them in partnership with some of the other groups that are involved with this campaign. I think we'll be looking forward to probably singling out one or two of some of the kind of like worst offenders within this industry in the coming months, as is something we have done in other parts of this campaign. And that strategy seems to be, I think, fairly effective, because a lot of times one insurance company will look at kind of who's getting sort of a lot of the pressure, taking a lot of the heat, and saying, oh, we don't want to deal with that. Maybe we'll come to the table and have a conversation here. So we'd love to have folks involved in some of those efforts going forward. And I can put my contact information in the chat for now as a point of contact for that.
That's great, Mary, and I hope you will put your contact information in the chat. Of course, you also now have contact information for all of us who are on this webinar, so I hope we can expect to hear from you in the future, and all of us who are on the webinar today can serve as conduits to our colleagues and to our organizations for sharing this information more widely. There are two questions in the chat that are kind of related to each other, and they have to do with kind of the broader landscape of the divestment movement. One of them from Melinda Lada says, this has me thinking about investments held by hospital systems, retirement accounts offered by physicians and benefit packages, etc. I hope that all of healthcare will divest from fossil fuels. That certainly brings to mind the work of Healthcare Without Harm. And I don't know if we have somebody from Healthcare Without Harm who's on the webinar today. If not, maybe, Mary, that's something you can reflect on, or there might be other kind of larger contextual pieces that you can share about that. And then from Bob Gould, who's with my own organization, PSR, who reminds us about the possibility for some kind of collaboration on divestment related to nuclear weapons. He says, I wonder about the possibility of practically connecting work on divestment on climate with ongoing parallel activities on nuclear weapons issues, illustrated by the work of the International Campaign to Abolish Nuclear Weapons and the Bring Back I beg your pardon, Don't Bank on the Bomb campaign. Mary, would you like to respond, to at least start the response there?
Sure. I guess for that first question, I don't know if anybody from Healthcare Without Harm or other organizations that may be working on some of the other entities within the healthcare field would like to speak first. Just want to give you a second to get off mute in case you're trying. Okay, well, so this is not an area that we have worked on since our focus has been on the insurance industry, but I do think that as, you know, if those efforts move forward to kind of push other parts of the healthcare industry to divest themselves, that only adds to the narrative that this is something that should be expected out of all aspects of the healthcare industry, and kind of further helps to, yeah, I think reinforce the narrative that the hypocrisy of investing in fossil fuels is something that, you know, is no longer going to be kind of socially acceptable for kind of any aspect of the healthcare industry. But I would definitely encourage, folks to talk with. I'm sure it's folks at Healthcare Without Harm, and maybe some other organizations that are working on this effort.
Thank you. We have a comment from Ben Gordon. He says, here in Louisiana, the chemical and plastic industry is dumping deadly toxins on communities of color such as St. James and St. John Parish along Cancer Alley between Baton Rouge and New Orleans. It also makes these folks who live there at greater risk for COVID-19. Good observation. Dr. Donnenberg, I wonder if you wanted to comment on that? Dr. Donnenberg, I think you're on mute. No?
I am not on mute.
We got you?
I'm sitting here trying to think of something to say and coming up short. So I just say thanks for pointing that out.
Well, fair enough. Yeah. Certainly, the harm done from oil and gas doesn't end at the end of a pipeline, but there is so much that's done with these products in terms of processing and refining, all I think in quotes, because the refining process is more like a process of removing toxic substances from one product and putting it out into the environment. So we see that in regard to oil refineries. We also see that as gas or ethane, which it comes from gas and accompanies methane, is turned into plastics. So it's a long and dirty pipeline, and I think we have a lot to learn about many aspects of it.
You know, that is related to another comment, actually from, let's see, Karen Sisler, who talks about just the environmental effects of just stuff, of, you know, all the stuff we buy and make and waste and throw away and put into landfill, and how just excess in general plays into this. And I think those are really good points. I think we don't need to feel guilty personally if that's not productive for us. We need to take action, try and, you know, buy less stuff and throw away less things. But I think we also need to focus on the bigger picture, because it's the big industries that are doing the great damage. So, you know, this seminar is about divesting from insurance companies, and it's an important piece of that. But there are also, you know, other things we can do. And, you know, with an election coming up, that's one of the major things as well.
Thank you for that, Dr. Donnenberg. Yeah, I think that certainly from the Physicians for Social Responsibility perspective, yes, individual actions help, and they're important, I think, in terms of motivating people. They can serve as kind of a jumping off point for educating friends and neighbors. They keep us committed, but they're not going to do it. They're not what's going. They don't operate on a scale big enough to save us from climate change. So what we really do have to look at are policy changes and then campaigns like this divestment campaign. And we do have a couple of questions about divestment campaigns. I'd like to share a couple of them. I'll start with this one by Karina Mayer. I'm sorry if I'm mispronouncing your last name. She asks, what are some of the arguments that health insurance and other companies give for not wanting to divest? You've already dispelled the financial one.
Yeah, that's a great question. I think this will be actually our initial sort of communication to health insurers specifically to hear back from them. We'll see if they respond. I know our partners at the Connecticut Citizen Action Group, I believe Tom might be here on the call, have done some work to engage Cigna, but also some other companies. And what we often hear from them is that, oh, they're trying, that this will take time. Some of them maybe actually see that, like gas, for example, should be a bridge fuel and they aren't going to leave. But in terms of divestment, I think a lot of it just comes down to inertia and to not having, kind of really seeing the full picture of trying to align some of their investments with some of their stated so-called sustainability policies. So I think for a lot of them, it's really talking with them about, hey, this is actually a part of that, and seeing if we can push them to divest. But for many of them, especially on the underwriting side, they may have just completely different views about, what's best for their business. And even if they're sort of already admitting that climate change is affecting their own industry, or they know that it's a big problem, they're still, underwriting and investing in fossil fuels. So it's nothing satisfactory, I would say.
Thank you. Here's another question about about divestment campaigns as a strategy. This is from David Redlin, and he asks, what evidence is there that divestment campaigns are effective? If health insurers divest, money will flow in from elsewhere as long as there are profits to be made. Wouldn't it be more effective in decreasing potential profits through regulation and decreasing demand for fossil fuels?
Yeah, it's a great question. I think largely what we have seen with some of the divestment campaigns is maybe not, at least in the near term, having a material impact on a company's finances, but on the continued reputational risk and sort of the social license of not only the fossil fuel industry, which of course is kind of increasingly becoming kind of the big villain, but for anybody who's sort of seen as actively supporting and financing the fossil fuel industry. So I think that is a big part of the value here, is actually shifting the conversation and seeing that there are financial institutions and others who, they're sort of at their peril continuing to invest heavily in these industries, which sort of hopefully creates sort of a herd mentality of like, okay, this is something that we need to move away from. Many of these companies are sort of afraid of being seen as kind of the last in line to do something that they is seen as innovative or kind of expected of them. And so I think it's really that social license piece that is helpful. I mean, to the point around somebody else will just kind of pick that up. I think at some point the theory is that, well, enough will pull out that actually will affect the financing of some of the fossil fuel entities. I will say on the underwriting side, that's something that we often heard in the beginning of this campaign as well, was that like, all right, well, if Chubb Insurance decides they're not going to provide insurance coverage to build a new coal plant, somebody else will just come in and take that business. But we're actually seeing, because enough of them have started to move away from that entire sector, that health insurance for the coal sector is becoming increasingly unavailable and is becoming more expensive. And so it's kind of squeezing that market and that availability.
Thank you. Here's a question from Dr. James Hernandez. Here in Arizona, there is a lot of construction using cement. Are there any efforts to discourage use of cement, such as tearing down relatively new buildings to build newer buildings? Awareness by PSR, a tax on cement? So I'll just start a response to that by saying that this is an issue that PSR is aware of, and I'm afraid we really haven't taken action on it. And that's not at all because it's not an important issue. It's really just a bandwidth problem where we're a smaller organization than I wish we were, and kind of have to marshal our forces. There are other organizations. I'm trying to think if we have anybody on this call today who can chime in regard to cement, both in terms of its emissions, the emissions related to cement, and any options for heading it off. Do we have any takers for that? I'll give you another moment to unmute yourself. If not, I'll move on to the next question, but don't hesitate to chime in later. We still have about 7 or 8 minutes left in this webinar, and we have a ton of questions. They're really, you guys were shy at the beginning, and you're not shy now, so I'm going to move ahead to the next question. From Cynthia Mahoney, are there any figures available on how much better the health insurance industry would have done if it had not invested in fossil fuels for the past 5 years?
I can take that one. That's a great question. I know that some studies have been done for entities like the New York City Pension Fund. There were some of those studies. I have not seen any on the kind of insurance industry broadly, or them as investors, let alone the health insurance sector. But it is definitely something that's, I think, would be an interesting data point and add to the story. So yeah, thanks for bringing that up. It's a good idea. Thank you.
Bob Gould chimed in again, saying he's still interested in hearing from Mary about the possibility of connecting anti-divestment campaigns. He was asking specifically about with the disarmament-related issues. He said that got lost in the last response to Healthcare Without Harm. And then there was also a comment from Ben Gordon who said, good connection, nuclear weapons and pollution. He suggests that we also look at guns versus border issues, and he cites 3 organizations, Veterans for Peace, Pax Christi USA, and the War Resisters League as possible sources for information. Mary, did you want to add to that?
Sure. Yes, I forgot to address that in my previous answer, so sorry about that, Bob. I would be happy to talk with you about that. It hasn't come up, but yeah, I think it'd be great to just talk about what that kind of collaboration might look like. Bob and I first met actually at a Veterans for Peace event a few years ago. So yeah, very happy to chat about that with you.
Thank you. Here from Melinda Lada, she says, I wonder if we could use the same strategies that helped divest from the tobacco industry. I guess, Mary, that's one for you. Dr. Donenberg, if you have thoughts about the role played by the tobacco industry and some of their shenanigans in terms of trying to hide information about climate change, please feel free to chime in too. Mary?
Yeah, thanks. I don't want to put you on the spot, but my colleague Ross was actually has a history of working in the anti-tobacco campaigns. Ross, I don't know if you want to say anything there about divestment efforts there.
Oh, you really did put me on the spot there. Hi, everyone. This has been really fascinating. Great job, all the speakers. I worked on global tobacco for about 13 years before I got into the climate movement. It's so many incredible parallels. And a big one, I think one of the reasons this thing is exciting, and I will answer the question in a sec, is just the voice of health professionals, which obviously in the tobacco control movement was like absolutely foundational. So there are lots of parallels. I'd say, you know, the tobacco divestment movement was inspired by the anti-apartheid divestment movement, which was how I got my start in activism, which in turn has sparked the fossil fuel divestment movement. So there are a lot of parallels. I wouldn't say that the groups that have been working on it, it's different groups, but with very similar strategies, which is both, it's a social license. I think also what's a little different with fossil fuels, I put some things in the chat, is just the the fact from a financial perspective, they're just absolutely horrendous investments. And so from a fiduciary perspective, health insurers or hospitals or anyone else who are heavily weighted in fossils are actually losing money. So that's what I got to say. Check.
Mm-hmm. Thank you, Ross. Thanks for chiming in on that. Anybody else want to chime in? Dr. Donnenberg or anybody else? There are several comments in the chat on the subject, including more from Ross Hammond, so please take a look at the chat. We're running out of time, but Dr. Donnenberg did post something that I want to return to and to give him a chance to speak. He says to respond to David Spence, what about asking them to invest? I'm sorry, this is in terms of I think the insurance companies. What about asking them to invest instead in renewable energy? That would bring costs down and make it even more attractive. Dr. Donnenberg, I'm not sure if I did justice to your thinking there. You want to chime in on that, and we'll see if anybody else would like to add.
Well, David's comment above that was, should we suggest alternatives to these insurance companies, what to invest with as they sell their stocks in fossil fuel companies? So that was just my my amateur financial advice there, because some alternative energies have thus far been subsidized. The need for subsidies has been, and usually from government, the need has been going down, but increased investment could certainly help. And so just sharing a thought.
I'd like to add to that if I'm not cutting somebody else off. I'd like to suggest to the Sunrise Project that as you engage health professionals in the divestment campaign, this would be a perfect message to accompany it, because from the health perspective, there are so many co-benefits to the renewable energy movement, or so long as it's the safe, clean, healthy, renewable movement. Clearly, there's been some contention about what gets to be considered as renewable, but if we're really talking about truly renewable energy sources, they do away or avoid so much in the way of contamination and pollution. They improve the safety and health of our homes. They are becoming more and more affordable. And of course, they also provide jobs. And I just want to mention for a quick moment that jobs are really also an important factor of health, certainly to have adequate income. Jobs are often people's access to health insurance, and both the stability of income and also, frankly, the recognition that we offer in this society to people who work are important components of mental health. So as we move forward with divestment work, and as we're speaking in our health and medical voices, I think we should really be embracing this very important point. And thank you, Dr. Donnenberg. I think we might have time for one more quick Actually, we're kind of out of the questions as I see them on the group chat. I hope I didn't skip over anybody. Maybe I'll just turn this back over to Mary Sweeters to wrap up and give us a sense of what we might expect to see from the divestment campaign in the coming weeks and months.
Yeah, thank you. Thanks again to everyone for attending to this today, and to Barb and to Michael for your expertise and your thoughts on this. In terms of next steps, there's definitely going to be more work to be done to pressure and highlight some of the individual companies, as I mentioned, to sort of make examples of them within the health insurance sector. So I'll put my email, excuse me, in the chat again. And folks, please do feel free to reach out to me or to Barb or to other points of contact if you are affiliated with some of the organizations that may be involved in this effort. To get involved, we are always looking for people who are happy to be spokespeople to various constituencies, whether it's directly to the insurance companies or into the press, as I mentioned. I think we've had conversations around potentially other petitions down the line, and some other work going into the new year. So we'll probably put a little bit of a pause while things are heating up, leading up to the election. But I think we'll be certainly back in swinging very, very shortly here. So thanks again to everyone for joining. And I did put a link to the page on the Insure Our Future website that's focused on health insurers. We'll be providing updated information there and ways for folks to plug in. We also have what's just started was an email list that's focused around health insurance divestment. So if folks do want to join that, please do email me.
Well, thank you, Mary. Thank you, Dr. Downberg, who actually just chatted to us saying he's got to run. He's got another commitment at 3 o'clock. It's the top of the hour. We'll sign off now, but please be in touch with Mary, be in touch with me. Both of our organizations look forward to working with you on this very important issue. Thank you and goodbye.
Thank you.